The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. We will start the broadcast in just a few short minutes. Welcome to the webinar. I'm the moderator for today's webinar. I'm Ashley Charlton, the Development Coordinator for PearlPoint Cancer Support. Let me introduce you to our speakers. Our first speaker is Vikki Pedigo, a practicing nurse practitioner at the Women's Institute for Sexual Health, a division of Urology Associates. Growing up in Appleton, Wisconsin, Vikki completed her Bachelor of Science degree from the University of California at San Diego in 2002. She continued her education at Vanderbilt University, earning her Master of Science in Nursing degree in 2009 and was inducted into the Sigma Theta Tau International Honor Society of Nursing. Vikki specializes in the treatment of female sexual and pelvic health with a holistic approach. She began her career in OB/GYN, which provides a strong foundation for her work. After discovering her passion for women's health, she further developed her practice with extensive training in the specialty of sexual and pelvic health. Our second speaker today is Margaret Martin, PearlPoint's nutrition educator and registered dietitian. Margaret Martin is a licensed dietitian and nutritionist in the state of Tennessee, as well as a certified diabetes educator. Margaret graduated from the University of Alabama with a Bachelor of Science in Dietetics and received her master's degree in nutrition science and public health from the University of Tennessee. She has more than 10 years of experience in clinical nutrition. If you have any questions during the webinar, you can submit them in the panel on the right side of your screen. Our presenters will be answering questions after the presentation. Connect with us on Twitter at MyPearlPoint. Use the hashtag PPCSWebinar. After the webinar, complete the survey so we can improve our webinars and better serve you. Here, you can take a quick look at our agenda for today. We'd also like to take a moment to thank the Memorial Foundation for helping make today's webinar possible. A quick disclaimer, PearlPoint Cancer Support is not a treatment facility. We are a nonprofit organization that provides education and resources for cancer survivors. The webinar does not provide medical care. Always talk to your healthcare team before changing your diet or if you are having any side effects from treatment. So, who is PearlPoint Cancer Support? We are a nonprofit support organization with the mission to create a more confident cancer journey for adults anytime, anywhere. We've been serving survivors, co-survivors, and healthcare professionals for over 26 years. We provide education and resources to MyPearlPoint, a website dedicated to educating cancer survivors. Our main focuses are cancer education, clinical trials, nutrition, and survivorship. Visit MyPearlPoint after the webinar to create a free dashboard and receive personalized resources such as the Cancer Handbook, which we currently have available for multiple cancer types, including breast, lung, stomach, pancreatic, colorectal, esophageal, liver, and others. You can also learn more about side effect management by watching the Eat to Fight video series. On the home page, click on the Nutrition and Cancer section to find the videos. Now I'm going to go ahead and turn it over to Vikki to tell you more about WISH.
Thank you so much, and thank you for this opportunity to be here and share this information with you today. So at WISH, we are 2 women's health nurse practitioners, and we are dedicated to providing sexual health care to our community. So we are part of Urology Associates. We're a division of Urology Associates, and that is the largest urology practice here in Middle Tennessee with over 30 urologists and about 13 nurse practitioners and physician's assistants. So we have a lot of support, and we're really passionate about taking care of women's sexual health needs. Can I get the next slide? So this is just a brief overview of what I'll be talking about today. I do think it's important for us to discuss female anatomy and sexual function, kind of talk about how cancer and cancer treatments can affect sexuality and vulvovaginal health, and then we'll get into the nitty-gritty of some of the most commonly seen side effects that I see in my practice, talk about how to take care of your vagina, very important information, and then go on and talk about some different options you can speak with your healthcare provider as well and provide you with some resources. Next. So this is a side view of female anatomy. So if you look all the way over to the right-hand side, that white lump down at the bottom is the pubic bone. Right behind it is the bladder, and then sitting on top of it is the uterus. And you can see the vagina tunneling down there into the vulva, and then the colon and rectum behind it. Next slide. What may be a little bit less familiar to a lot of people, this is the vulva. So the vulva refers to all of the external genitalia. So you can see at the top is the mons pubis. So what that is the hair-bearing tissue. The clitoris, which is just the tip of the clitoris, the glands of the clitoris is visible right underneath that. And then if you spread the labia minora open, there is the urethra where the urine passes out. The introitus, that's the opening to the vagina, And then a really important piece of tissue is what we call the vulvar vestibule. And that's this narrow band of tissue that's very sensitive to hormones, and it runs at the level of the urethra all the way around. And I'll get into why that's important in a few minutes. Next slide. Now this, I think, is really interesting information. So the clitoris is just not the part that you can see. That little tip is just the glands. The clitoris actually extends all the way down. You can see the branches here down into the pelvis, and it can be up to 10 centimeters in length. So it's really a much larger organ than a lot of women know. It's obviously very important in sexual arousal and is something that we'll focus on a little bit later as well. Next slide. Moving on, this looks at the pelvic floor muscles. So the pelvic floor is this bowl of muscles, and it attaches to the hips and the pubic bone and the low back. And it supports everything. It supports your bladder. It supports your uterus. It supports your rectum. It's really important in how you walk and how you sit. And if it's not working correctly, can be a big source of pain for some women. So things that can cause these muscles to become dysfunctional would be pelvic surgery, can be a trauma of any kind, can be repetitive motion. So these muscles are very, very important, and they can cause just generalized pelvic pain, and they can also cause pain with intercourse as well. Next slide. So this is a model of a man's sexual response. So it's very linear, and not to put down any men, but it's a little bit more simple than we women are. You can see that at the top there's excitement, and then he gets an erection, he has an orgasm, and then there's a little period of time where he can't do it again, and then in a lot of cases he'd be happy to. So this is that male model, and it kind of looks like this if we were to put it visually. Next slide. It's a bit like a light switch. So we know that women are not as simple as this. We're a lot more complicated. So if you were to look at that visually, it would look like this. Next slide. A lot more busy. We are very complicated creatures. So if we go on to the next slide, this is a model of a lady named Rosemary Basson made this model up in 2001. And what she looked at was, well, what are all the factors that really go into a woman's sexual response? And any interruption in this can really have an impact on sexual functioning. So the first thing is women need to feel physically well enough. And in my world at the Wish Clinic, a lot of that comes down to pain. So if a woman is having pain with intercourse, that has to be the thing that we address first, because a woman's body will shut down the sexual response if she's having pain. So libido will go away, arousal will go away, orgasm will go away. So we need to deal with that first. I think another important thing here is the driving force for women. We don't have this need, this biological need to release sexual tension like men do, and we have a lot of other motivations other than sexual pleasure for intercourse. One of them being that emotional intimacy with our partners, and I think that's something that a lot of women miss when they're not being sexually active. I think another important point on this graph is if you look up at the top, sexual neutrality. So what that means is that most women aren't walking around just waiting to get home and tear their clothes off and have sex with their partner all the time, but being what we call sexually neutral, so being a little bit open to that advance of your partner is a good goal to aim for. Next slide. So disruption at any step can certainly interfere with that. So cancer absolutely can impact women's sexual functioning in a variety of ways. It's a very prevalent problem. The National Cancer Institute estimates that 40 to 100% of cancer survivors, depending on what study or survey you look at, really do experience some form of sexual dysfunction. And those fall into a lot of different categories. They can be that pain category, or it can be that arousal, orgasm, libido category. Sexual complaints are reported by a lot of different survivors, anywhere from 25 to 90%, again, depending on the type of cancer, the treatments that women underwent, and just depending on what you look at in terms of the data. And then sexual dysfunction may be the more distressing problems experienced by breast cancer survivors, and I can certainly say clinically that I see this a lot. That doesn't mean that's not something we can do. There are absolutely things that we can do to help, from simple things at home to things to discuss with your provider. Next slide. So why does cancer affect sexuality? Well, this is just getting into the treatment piece. Of course, there's a lot more to this, but just to touch on it, the first being surgery. Depending on what type of surgery, that can really change a woman's body perception, how she looks at herself, does she feel sexy. It can really decrease sensation. So a specific example here would be for a breast cancer survivor who had a mastectomy and lost her nipples, which are a very sensitive area. Surgery can also change how a woman experiences orgasm. So the cervix and uterus can be very important in orgasm. So women who've had a hysterectomy can see a change there that's different. And then, of course, the hormonal changes. So women who have had their ovaries removed or are on medications that can change their hormonal status, that can affect us as well. And then lastly is pain. So pelvic surgery can cause pain. It can cause a disruption in those pelvic floor muscles. So that's something to be considered as well. I think the last thing on here I want to touch on is just those medications that we talked about. So women can be on medications that are suppressing their hormones, and those can affect things too. So we'll get into all of that. Next slide, please. So this is just a list of the top side effects that I see in my practice. Coming from cancer survivors. So the first lot kind of fall into that pain. That pain can come in a lot of different ways. So vaginal dryness, that really irritating, feels like sandpaper type of dryness, can be bothersome not just with intercourse, but just in daily life as well. Women will sometimes even tell me they can't wear panties anymore. They are wearing skirts all the time because it's just so uncomfortable. That dryness can be felt as itching as well. So this looks like a woman who feels like she might have a yeast infection, doesn't have the discharge, but just itches all the time and keeps being told there's no yeast there. So that can be a side effect. These things can be due to what we call vaginal atrophy, or lack of estrogen to the vaginal tissue that can come from some of those medications or after some of those surgical interventions. Burning in the vagina, pelvic pain, sometimes this is more generalized, really low in the belly or a little bit over to the side. Painful urination, that can of course be something that looks like a urinary tract infection, but if it's not, it can be pain from that urine passing over that really sensitive and damaged or irritated vaginal tissue, so it can be more external. And then all of that can translate into pain with intercourse. And then we have this other category of the decreased libido, arousal, and orgasm, which, like I said, pain has to come first. So we have to help women become pain-free before we start working on the rest of that sexual functioning. Next slide. So how do you take care of your vagina? This is really important information, and I think that a lot of us, as young girls or as young women, don't necessarily get all that much information other than keep yourselves clean. Here in Nashville in the South, there are a lot of grandmas and moms who are telling their young daughters to continue douching. So that's the first thing I want to say is, please, no douching unless a medical provider has asked you to. The reason for that is that we all have good bacteria in our vaginas. These are healthy bacteria. They keep the vagina acidic, which is a good thing. That helps to fight off other infections, yeast infections or bacterial infections. And so douching washes all of that away. It can also really dry out the tissue. So for women with a lot of dryness, douching is just going to make that even worse. So please, none of that unless some medical provider tells you to for some reason. Another tip is to use natural soaps and detergents. So you want to look for something that is fragrance-free and has no added colors and that type of thing. Soap to the hair-bearing tissue is absolutely fine as long as it's gentle. But inside the vulva, so if you open up your labia and inside there, no soap is needed in that area. Water is plenty sufficient. I promise you will not have an increase in odor. And what that allows that to do is we don't want to wash away those good bacteria. We want to allow them to be there. So changing those practices, while you're not causing anything that's happening to you, these things can help to decrease any extra irritation. Dryer sheets, I would definitely throw those away. Dryer sheets can leave a residue on your panties, which can be really irritating. If you have to use dryer sheets, I would just separate out your panties, although that's going to be a bit of a pain from a laundry standpoint. But believe it or not, using tin foil, so balling up some tin foil, putting that in your dryer will do the same job. I would really encourage you all to stay away from these OTC, which means over-the-counter vaginal products. So we've all seen these commercials for, having to stay clean, these feminine wipes, these feminine washes. A lot of these have chemicals in them that are incredibly irritating. The vulva is the most sensitive tissue in your body. So when we're then putting irritating chemicals on it, that can increase that irritation, cause burning. I've seen people with really severe changes all caused by just using that. So I would really save your money on that front and not buy them. What you can use instead is coconut oil. So coconut oil is a wonderful, all-natural product. It comes in a jar. These days you can buy it almost anywhere. Get it at a grocery store. It's usually in the health food aisle or by the other cooking oils. And if you're having irritation or itching, you can take a little coconut oil in your hand, rub it all over your vulva, even up into your vagina. It will not make anything worse unless you're allergic to coconut. If you are, of course, don't use this. So that's something I think every woman should have in her medicine cabinet. Wearing white cotton panties, at least consider having cotton and not wearing thong underwear. Again, just trying to reduce any irritation. And then when you are sexually active, I would really recommend using a good lubricant. So women report that they are 70% more satisfied with their sex lives just by using a lubricant. So why not? But you do need to be careful, again, in what you buy. Some of these are very irritating. They have glycerin in them. Glycerin's an ingredient that sucks the moisture out of skin. Again, not something we want. So really look at your products. Not to name names, but I guess I'm going to. KY and Astroglide are some of the worst offenders. So if you have those in your bedside table, I'd recommend changing them out, and we'll get to what I would recommend instead on the next slide. So lubrication with a non-offensive product. So here at our office, we use Slippery Stuff. I'm not tied to this brand at all. I just happen to know it's a good one. It's water-based and it's glycerin-free. You can get it on Amazon. Coconut oil can be enough for some women for intercourse, so that's another thing to try. Other things you can do at home to try and get your sex life and reduce these side effects is just regular arousal. So getting the blood flowing to the genital organs is really important and can help to decrease some of these side effects. And that can be through intercourse if you're up to that. If you're not, consider just using some sexual aids or toys. Zestra is a arousal oil. It can also be bought on Amazon. It's all natural. Not something you'd want to use if you had a lot of irritation, but it can really enhance that arousal for women. Neogen is a soothing vulvar cream. So this is a non-hormonal, non-prescription soothing cream. So for some of that irritation can be really beneficial as well. And then if you're kind of in a place where you feel like through the course of your treatment, your vaginal opening feels like it's a little smaller or a little tighter, vaginal dilation can be really helpful. And this can be a great preventative tool as well. So something that if you're up for it and you're going through treatments and you're not sexually active, just placing a dilator in your vagina for 10 minutes a day as often as you feel up for it can be helpful. If you're trying to stretch that vaginal opening, you want to start with the very smallest dilator. So this picture over on the right-hand side of that slide shows a set. You can see that the yellow one is really tiny. It's about the size of my pinky finger. So you want to start with that. Put it in for 10 minutes a day, and if it doesn't cause you any pain or discomfort, great. Keep using it for a week. Then you want to move on up to the next size, and you just want to place that next dilator ever so gently into your vaginal opening. If it causes pain, stop and back off. This should be a really slow way to stretch that vaginal opening back open. I put two resources down here, either Soul Source or PureRomance.com. These are both sex sites. They're pretty good, clean sex sites, but they're a lot cheaper to buy on these sites than they are to buy from a medical supply company. Next slide. So, of course, there are other things that can be done with the help of your healthcare provider. And I do want to make a note here that if you are having any of these sexual side effects, or even ones that I haven't talked about or I'm not talking about today, please, please, please bring them up to your healthcare provider. It is their job to help and take care of you, and if they don't know the answer of how to help you, then it's their job to try and help you find somebody. If you get a negative response from that healthcare provider, if you get the, oh, it's just part of it, or, oh, you know, there's nothing to be done, drink a glass of wine, yes, women still hear that, then shame on that healthcare provider, and, you know, please make sure you get your questions answered by somebody, and I'll give you some resources where you can find some good people. It's not that folks don't want to help you, it's they may not know the answer and they don't know what to say, but be brave and speak up and ask your questions. So listed here are just a variety of things that can be done to continue to help women as they struggle with these sexual side effects. And I think it's important to know that there are a lot of options, so please don't give up hope. There are a lot of options out there. So the first, believe it or not, is something called pelvic floor physical therapy. So when those pelvic floor muscles that we looked at earlier become dysfunctional and they start causing a lot of pain, the first treatment we do is we actually send women to a pelvic floor physical therapist. You can find these. We're in Nashville. We're very fortunate. We've got a lot of great physical therapists. And if you think of those muscles like any other part of your body, then a physical therapist is the expert in the musculoskeletal system. So they're able to work with women to get those muscles to relax down, to not be so tight and not be so painful all the time. Vulvovaginal estrogen is something that we will use in certain women. It's certainly not appropriate for everybody, and we always work in collaboration with the oncologist and only use it when appropriate. There are a lot of different vulvovaginal estrogens out there, so tablets and creams and rings, and sometimes we get different responses by using different ones. But this is an option for some women, but not for all. What estrogen does is giving back estrogen to that vaginal tissue can help it to become less dry and less irritated, to have more moisture, to be thicker and stretch better, and decrease some of that pain if it's caused by lack of estrogen. Muscle relaxers we'll use occasionally when it is really that pelvic floor that is staying very tight, and then the rest are some advanced therapies that are available as well for the right person and with the guidance of your provider. Next slide, please. So this year has been a really monumental year for vaginal health, and we're really excited to be able to offer this new therapy. It's called Monalisa Touch, and I didn't make up that name. It's an Italian laser. So if we can go to the next slide, we'll just talk about this really briefly. But this Monalisa Touch was FDA approved in December of last year. It has been used for a number of years in Europe, primarily in Italy is where the research comes from. And it is a non-hormonal, so more appropriate for women who can't use hormones for whatever reason, a non-hormonal way to help with that atrophy or lack of estrogen to the vaginal tissue. So again, what that does, that lack of estrogen to that vaginal tissue can cause vaginal dryness and burning and itching, some pain with intercourse, and pain with urination. And Monalisa Touch is a non-hormonal, non-surgical, it's a CO2 fractional laser. So this is the type of laser that has been used for years by plastic surgeons on faces for, you know, non-surgical facelifts. And this is a different application of this. And what we do is we put this probe in, which sounds scary, but it's pretty small actually, and basically paint a laser beam around the inside of your vagina. It improves collagen growth, it improves fibroblast activity. So if you look at this picture here, the picture on the left-hand side is before this treatment. So this would be atrophic tissue, lack of estrogen. There's not a lot of depth to that tissue. That top kind of pinky purple layer you can see is very, very thin. Now if you hop over to picture B, you can see that the layers of tissue, so that purple layer has gotten a lot thicker, and it's got all these little inroads from the bottom layer. What that does is that allows the tissue to stick together more easily, so the layers of that tissue can stay and not be as painful. So this process, it takes about 3 to 5 minutes. It is almost pain-free, and by that I mean that occasionally somebody will feel kind of a little, almost a light snap where that laser is, but that's pretty rare, and it's 3 treatments 6 weeks apart. You can find more about this if you're not in the Nashville area. Definitely Google it. And see if this might be something that could help as well if those first-line things, the things you can do at home, aren't helping. Just to note, this may not be an appropriate treatment for women with a history of pelvic radiation. So pelvic radiation can change the structure of that tissue, so we're going to be very cautious in using that in somebody with a history of that. And if you've had reconstruction of your vagina with mesh, this is also may not be an option, but worth talking to your healthcare provider about. Next slide. So this is just a little diagram of what this Monalisa touch looks like. If you look, this is the probe going into the vagina, and then all those polka dots up in the top right picture, that's the laser beam kind of being painted around the inside of the vagina. So again, it only takes about 3 minutes. Next slide. So those that we've already talked about are more on the pain or irritation or burning side, but what about desire and arousal and orgasm? Because all of these things can definitely be impacted and be side effects of cancer or cancer treatment as well. Argimax or V-Cell is an herbal supplement. Speak with your healthcare provider before starting any supplement, but what this does is it increases the blood flow to the genital organs, so it can help with that arousal piece. It's not appropriate for those who get cold sores or genital herpes because it does have an ingredient that can exacerbate that. But this supplement is all natural. It actually has some good research behind it, so that's a good one. Coming back to lubricants, of course, that can help with arousal as well, so getting something that's good. We already talked about Zestra as being an option. The other sexual aids or toys, whatever might be beneficial. This one I listed here is a clitoral suction device. So women who have difficulty with orgasm, most women actually have clitoral orgasms. They don't have vaginal orgasms. So if you're in that category, it's about 75% of women can only have clitoral orgasms. If you're struggling with orgasm, then this clitoral suction device, it's a little suction you put on your clitoris about 10 minutes a day, and it just kind of draws blood into that clitoris to reteach the clitoris to be functional again. And then certainly sex therapy or counseling for any of these things can be so beneficial. I think sex therapy unfortunately gets a bad rap, but these folks, these therapists are incredibly knowledgeable in helping women with all types of backgrounds work through whatever is challenging them in terms of their sex lives. Different things that you could consider is some erotic reading. So, and this is not, I'm not at all suggesting pornography for everybody, but just a romantic novel. We know that we women are really, really story-based. So reading something sexy 10 minutes a couple times a week, just getting your brain back into that time, into that framework. Any sexual techniques or positions, and then help with communicating with your partner. Your body may be different now, and it may be difficult for you and your partner to have good open communication about that. And certainly having somebody help walk you through that can be so, so beneficial. And then not to comfort with your body and how your body has changed is also a really important part of sex. And I've really, focused more on these medical things today, but I don't want to negate how much that impacts women. So that having somebody to talk to you about that and those changes can be so important as well. Next slide. I do find that women really like to have a really specific something, a recommendation. So this is a little toy that a lot of women really respond well to. It's called Sierra. It is a small, it's a hand-free device. It encourages good arousal and lubrication. It goes over the clitoris, and it just uses some really gentle suction, and it's used prior to sexual activity. So you'd use it a little bit before things got going. It can help with that arousal and lubrication, and can actually stay on during intercourse as well. So that is just something to consider. Next slide. So this is my all-time favorite quote, just because we women are tough. So just going to leave that out there. And next slide. So thank you so much for allowing me to share this information with you. I do have some additional resources listed on the next slide here. Of course, our website, our Monalisa Touch, the Fiera, and then if you're not in the Nashville area and you are looking for a healthcare provider who can help you more specifically with your particular situation and the side effects that you're experiencing if they're not responding to these things I told you about today that you can do at home, the International Society for the Study of Women's Sexual Health is our professional organization. It's a wonderful group of people, and they have a lot of providers listed, so it might be a good place to find a provider who's really knowledgeable about all of these things as well. So have a look at that. And now I'm going to turn it over to Margaret.
Thank you, Vicki. That was a great presentation. Well, now let's focus on managing nutrition side effects from cancer treatments. Food choices and nutrition can help women manage some of the side effects, even women with a lot on their plate. Next slide. Cancer in female reproductive organs are often located in the lower area of the female body trunk. I'm often asked as a registered dietitian, well, what can a dietitian or some food changes do to help me? I have cancer in my reproductive organ, not cancer in my digestive tract. Well, that's a great question. Let's look at some of those answers today. Next slide. Types of female reproductive cancers might include ovarian, cervical, uterine, or vaginal cancers. Treatments for these cancers may challenge or change the way your body uses food and your ability to fight cancer. These changes are what we call side effects. So let's look at the location of reproductive cancers in relation to your digestive tract to learn more. Next slide. Starting with radiation treatments, as seen on the diagram on the left, these treatments are aimed or targeted at specific organs where your cancer is located. Of course, other organs may also be affected by the treatments, as seen in the second diagram on the right, especially nearby organs where your food is digested. Other treatments like chemotherapy and surgery for your cancer may also affect how you digest food and your nutritional needs. Next slide. In my practice, I often hear 4 areas where ladies need support during cancer. So that's what I'd like to focus on today. The first being fatigue. Next, we'll touch on declining appetite or lack of appetite. Then we'll move on to changes in the way your body digests food or uses food. And finally, we'll look at survivorship. How can you get back on track? What may I eat to reduce my risk of disease after cancer and enjoy life? So let's first look at fatigue. Next slide. Fatigue during cancer is different than fatigue otherwise. Fatigue during cancer may occur because your body requires more energy and protein to repair damage by cancer treatment or surgery. Other side effects like pain and anemia can make fatigue even worse. Fatigue or lack of energy can make it difficult for you to grocery shop, prepare good meals, eat sufficiently, and maintain your quality of life. So let's look at some strategies that may help. The first strategy I might recommend is go for small mini meals. Mini meals are 2 or 3 foods usually, or beverages. You might aim for them every 3 to 4 hours. Your food is digested better when we have small meals frequently through the day. In other words, your body can access and use the nutrients and fluid more effectively. People often have less side effects if you have small meals frequently through the day. So that's one idea, and we'll look at some suggestions about what a mini meal is here in a minute. Secondly, if you're not hungry for a meal or for food, drink a nutritious supplemental beverage. There are many of those on the market, and your healthcare team can help recommend one or your registered dietitian. Thirdly, ask for help. If grocery shopping and meal preparation are just not happening for you due to your fatigue, ask friends, family members, or coworkers to bring a meal or grocery shop for you. That would be a big help. Think about physical activity if your doctor allows that. Walking daily can help improve your attitude. It can help stimulate digestive processes that happen on a regular basis, and it can enhance our mood. Even walking in the house, if you're not ready to walk outside, can be helpful. Next, if you find yourself eating often from a package or a bag, swap those food for high nutrient choices often. Including some type of protein at each snack or meal is helpful. Using iron-rich foods, which we'll talk about in a minute, is helpful. So, not to say you can't have food from a package or a bag, but if you find yourself doing that quite often, challenge yourself to have real food more often, like pieces of fruit or half a sandwich is much better than trying to eat something from a box or a bag. And finally, check your protein and fluid intake. Perhaps you're not getting enough of these vital nutrients, and that can make some people feel tired or experience fatigue. We do have on our website, my PearlPoint, side effect tracker forms or daily intake forms where you can write down what you eat and drink, the time, and any symptoms you might have. Try to do that for 3 to 5 days and see if you see any patterns so that you might be able to improve your intake. An example might be if you just have juice for breakfast, why not add a little protein with that? Maybe have cheese or an egg with your breakfast. Are you skipping meals? Well, maybe you need to add a little small lunch or small afternoon snack. These are just some ideas you might find that you're having with your food patterns. Next slide. Well, let's look at what mini meals might be. Mini meals are small amounts of food. You might serve them on a saucer or luncheon-sized plate instead of the traditional dinner plate, which can be 9 to 12 inches. Small amounts of food are more appetizing and can be consumed in a small amount of time, requires less energy, but you're eating more often, so you're getting the same amount of energy. Examples might be a fruit plate with some cheese, perhaps whole grain crackers with nut butters, like peanut butter, almond butter. Or for breakfast, you might have a breakfast egg burrito that you make at home and throw in some sliced veggies. Or later in the day, you might think of a cup of soup and maybe a half a sandwich. If you're not up for meats, beans, rice, and milk can be a great mini meal and have protein. Or a smaller mini meal might be yogurt with nuts. So make a list of mini meals that you find interesting, and then when you don't feel well or you need to eat more often, you'll have that resource for yourself. What about iron-rich foods? Iron deficiency anemia can be a trigger for fatigue in some people. If that's you, try to increase your intake of lean red meats. These might be the sirloin or loin cuts of meats, which have much less fat than the prime cuts. It could be ground beef or ground turkey that's 93% lean. Those are all good ideas. Pork loin or pork chops made from the pork loin area is another idea. If you're not up for meat, there are also iron sources in non-meat areas like fortified breakfast cereals, lentils, pumpkin seeds, kidney beans, tofu, and raisins, just to name a few. Now, these sources of iron are not the iron is not readily absorbable, So be sure to have a source of vitamin C at a meal when you have these non-meat iron sources. Vitamin C sources might be a citrus fruit or juice. It could be tomato or tomato juice, or some beverages now are vitamin C fortified. Next slide. Now let's look at appetite. Are you having a loss of appetite or decrease in appetite? Well, there is help for you. First, try to figure out what leads up to your appetite changes, and then try to add a strategy to work around that. For instance, aroma is a big trigger for some people to have a declining appetite. Maybe the aroma of food, which is more pronounced in hot food, warm food, is a turnoff. Well, then go for cool foods. Cool foods like sandwiches or fruit plate have very little aroma. If it's a beverage like a milkshake or smoothie, you can use a straw to even limit more aroma, and that may help you eat more often. Perhaps you just have a small appetite or you're getting full quickly. We'll go for the mini meals we talked about previously. Try to eat 2 to 3 times a day. Set aside dates to eat with other people. We tend to have a better appetite when we socialize. Are you feeling nauseous before meals? Are you skipping meals? Well, these can often bring on nausea when we skip meals, so try to eat often. If meat or some other strong flavored foods are turning you off, try to experiment with some new flavors. Marinades for meats are a great way to help you be more accepting. A tangy marinade is great for meats, or you can put maybe a lemon sauce on fish or vegetables. If sweet flavors are turning you off, maybe try a sour flavor. Maybe have pickles with your sandwich. So experiment with some different flavors. Swap the flavor you're having trouble with maybe with another one, like bitter or tangy. Appetite help also revolves on the quality of the food you eat. If you find you're filling up on what we call low nutrient foods, or some people call them junk foods, try to grab high nutrient foods or whole foods more often. These might be defined as pieces of fruit or vegetables, whole grain, breads and cereals. If you're not up for a meal, you can use a smoothie or a liquid supplemental drink. Those are all great sources of nutrition. And very importantly, accent the positive. Think about when your appetite's the highest and when you feel the best. And that's a good time to plan your best meal of the day. And of course, there is medication help for appetite, so be sure to ask and talk with your health care team about your appetite often. Next slide. Now let's talk about digestive issues. Often surgery or cancer treatments can change the anatomy of your digestive tract or change the efficiency of it, and that can mean you can have digestive problems, which may include gas, diarrhea, feeling full too soon, constipation, or ascites, the collection of fluid around your tummy. So identify what your problem is and try to develop strategies to go around that, and be sure to stay in touch with your healthcare team as well and ask them for their help. Some easy fixes might be, if you have gas, avoid or go easy on gassy foods and high-fat meals. We'll have a list of gas-forming foods here in a minute. But gassy foods and high-fat meals require a lot of nutrition or enzymes to digest that food, requires a lot of digestive activity to keep those foods broken down into small pieces. So if your digestion is already a little on the compromised side, that can add extra stress. So try to spread out your gassy foods and just eat high-fat foods occasionally. An example would be, instead of fried chicken, try baked chicken or oven fried chicken. Instead of French fries, maybe try a baked potato. these are just a few examples. Next, if you have foods you should be avoiding, keep a list on hand so you'll know what those are. Third, get a diarrhea or constipation plan from your healthcare team in advance. So when some of these problems arise, you'll be able to know what to do. And prepare your pantry ahead of time or ask friends or family members to help. We have a great list of pantry foods to keep on stock in your home, but here's just a few suggestions. Excuse me. Soft foods are easily digested. Those are cooked vegetables, meats, things of that nature. They're low in fat. Crackers, soups, nutritious, nutritious drinks, single-serve items like gelatin or yogurt, frozen dinners, and clear liquids like apple juice, cherry juice, grape juice, and popsicles. When you don't feel well, it's great to have these foods on hand to keep your nutrition going. Next slide. What are gas-forming foods? Well, I listed 3 groups here on our slide. One is vegetables that grow in heads, like, for instance, broccoli, cauliflower, Brussels sprouts, and cabbage. They may cause gas for you, so have them less often. Corn, turnips, onions, peas, lentils, peppers, beans, and nuts are another group of foods that may cause gas. And then some fruits may also trigger gas, like melons, apples, and avocados. Carbonated beverages, of course, are made by infusing the carbonation into the liquid. So you might have them less often or pour them in an open glass and let some of the carbonation fizz out. Also, chewing gum or using a straw can cause gas in some people, or eating too quickly. Also, lactose or dairy products may be a problem for some people as they go through treatments. Sometimes treatments cause us the inability to digest lactose or dairy products, and just going through life and getting older, we lose sometimes a sufficient amount of the enzyme lactase to digest lactose, milk sugar, or other dairy products. So the workaround would be trying to add non-dairy milks like soybean or cashew milk, cheeses made from different types of sources. You might try, instead of cream soups, have broth-based soups and sauces. And of course, speak with your healthcare team about your gas, because there are some great medications to work with that. Next slide. Now, what about survivorship? What are your goals after cancer treatment? Do you want to get back on track, increase your energy, have some stamina to get back to sports or activities you used to love, or maybe enjoy new foods or reintroduce some old favorite foods? Often I hear the request, how can I lower my risk for disease or cancer reoccurrence? Well, here's just a few tips to get that started. First, get your nutrition from a variety of foods. If you look over what you're eating and find you're just having 1 or 2 types of fruits or vegetables each week, well, take it up a notch. Challenge yourself to get 3 to 6 colors of fruits and vegetables a week. 2, eat. Don't just depend on dietary supplements. Sometimes when you're going through treatments, folks do have to depend a lot on liquid nutritional supplements and maybe dietary supplements, but now that you're past your treatments, try to reintroduce foods that are high in nutrition. 3, try some new foods, taste and flavors. Survivorship is a wonderful time to try some new foods. Sometimes during treatment, food likes really change. Maybe you found some things that you really love that you can't eat during treatment. Well, now's a new time to add them back along with some new ones. Be social. Eat out with friends or have people over, or join a supper club to make it easier to try some new taste and flavors. Next, aim for a healthier weight. Very important for women. Now, know that I did not say get or aim for ideal weight. There's a lot of research now coming out, especially about breast cancer, that just losing a modest amount of weight, if you're obese, can help you reduce your reoccurrence risk of cancer significantly. Why do we talk about weight loss if you're obese after survivorship? Well, it is because 20% of female cancer deaths can be related now to obesity, especially breast cancer, uterine, cervix, and ovarian cancer. Small steps can give you big rewards for weight control. One study done by Dr. Cheryl Rock found that modest weight loss, even a 5% weight loss, if you were overweight, significantly reduced the breast cancer reoccurrence in one study. So what that means in real terms is if you weigh 180 pounds, a 9-pound weight loss helped decrease the recurrence of cancer, breast cancer. Sometimes treatments and surgery can cause a lady to have premature menopause, and with that comes the increased risk of osteoporosis and heart disease. So looking at survivorship, making sure you get some excellent sources of calcium and vitamin D is important. If you're at risk for heart disease, losing just a small amount of weight, especially the weight around your waist, is very important. That's probably more important than what your weight is. If you already have elevated blood sugar, which can happen sometimes during treatment, losing a modest amount of weight through physical activity and better food choices can also reduce the occurrence of your prediabetes or elevated blood sugar from progressing to type 2 diabetes. We know this from the Diabetes Prevention Program, where we saw that only a 7% weight loss from walking or physical activity and modest dietary changes delayed the onset of diabetes. Well, what amount of physical activity? Well, about 150 minutes per week of physical activity was what was used in the Diabetes Prevention Program. And the dietary changes were simple, well, not simple, but low calorie, low fat. So nothing, you don't have to be on a fancy meal plan, in other words, to be healthy and to lose weight. So just wanted to challenge you to be healthy, aim for a healthier weight, choose real foods more often, and get those taste buds going again. If you need help, ask your healthcare team for suggestions on your meal plan you should be following, and for a referral to a registered dietitian that's experienced with oncology patients. Next slide. If you want a type of dietary pattern or a menu to go by, I might recommend information from the American Institute of Cancer Research, or AICR.org. They developed a way of eating called the New American Plate. Also, the Mediterranean diet or heart healthy menus are often recommended after cancer treatments for ladies. Well, what is the New American Plate, you might ask? Well, thinking about your plate, growing up, a healthy plate was thought to be 50% meat and then 25% vegetables and fruit and 25% bread. Well, that was full of probably a little bit too many calories and a lot of saturated fat, and not too much fiber. Now, the New American Plate is recommending that you have 2/3 of your plate or more to be filled with vegetables, fruits, beans, and whole grains, and then just 1/3 of your plate be filled with animal protein, fish, poultry, meat, and low-fat dairy. So that's just one way to kind of visualize it, and you can get more information on that from our website as well. Next slide. These are a list of some great additional online resources, recommended websites, in other words. Ours is called mypearlpoint.org. You can get great information on cancer education and nutrition there, and some great tracking forms. And then we have some other recommended website area resources as well. Now I'll turn it back over to Ashley.
Great. Thank you both, Margaret and Vikki, for your great presentations and all of your useful and informative presentations. Join us for our next webinar on Tuesday, September 15th at noon Eastern Time. Also on September 1st is the annual John E. Hastings Memorial Golf Tournament at the Nashville Golf and Athletic Club in Brentwood, Tennessee. For even more help with side effect management, download our free mobile app to your smartphone or tablet. Cancer Side Effects Helper app is available on iTunes and Google Play. The app offers quick tips to help you manage side effects such as nausea, fatigue, and change in taste and smell, all at your fingertips. Now, let's go ahead and take some questions. It looks like we have a couple questions here for Margaret. One person asked, I can't eat much at a meal. I seem to get full quickly since my radiation treatments. Any ideas?
Well, that's a great question. Feeling full too quickly or early satiety is a common complaint. One idea would be to drink less with your meals. I know sometimes we tend to drink, have a bite, drink, have a bite, but that takes up a lot of room in your tummy, that liquid, which may have less nutritional value than whole pieces of food. So if you just drink modest amounts at meals and save most of your fluid between meals, that's one idea. Small meals frequently helps. If you're eating a lot of fiber at a meal, you might try eating a little less fiber. Maybe eat your protein source first, your meat, fish, chicken, or beans. That helps a lot of people. If you find you're dealing with gas, you might want to talk to your healthcare team about ways to manage that. Sometimes gas happens and that causes us to feel full too quickly. If it's okay for you to have physical activity, walking helps stimulate normal digestion. So that can help your previous meal be digested well, so you'll be having a great appetite and a great capacity for your next meal. And of course, small meals really helps in this situation, just having two or three items rather at a meal rather than a big meat and three dinner. Thank you, Ashley.
Thank you, Margaret. We have another question for Margaret. What kind of diet should I eat after treatments?
That's a good question as well. If your digestion is back to normal, some good ideas might be to eat less processed meat. Processed meat, like meats in a package, tend to carry a lot of nitrates, and we know those are can be a risk factor for cancer. So eating less processed meats, more fresh meats, of course trying to eat mostly fruits, vegetables, and whole grains and beans is a great idea, and just having less than a third of your plate be meat. Some people find green tea is helpful to help them feel better and may help some people manage their appetite and weight control. And eating more fruits and vegetables. Sometimes during treatment we're not able to digest things with roughage like that, so adding those back really helps because fruits and vegetables are full of nutrition, fluid, and fiber, and those are three things we all need after cancer treatment. So those will be, I guess, some suggestions. In other words, we're talking about a heart-healthy meal plan after treatment. Thank you.
Great, thank you. Well, that's all the time we have for today. Thank you for attending today's webinar. Remember, you can visit mypearlpoint.org for more resources for your cancer journey.
Thank you.